When should you be on yellow alert and remain attentive to the potential signs of a gallstone-related condition? This is the topic we'll be discussing on today's episode of Healthy Hearts TV. Welcome to our channel, where we focus on health, prevention, adopting a healthy lifestyle, and various aspects that contribute to your well-being, enhancing your overall quality of life. If you find our content valuable, we kindly invite you to subscribe to our channel and click on the notification bell icon, so you never miss an update whenever we release a new video. Situated in the upper right quadrant of your abdomen, beneath the liver, is a small, pear-shaped pouch known as the gallbladder. Its primary function is to store bile, a yellow-greenish fluid containing cholesterol, bicarbonate, and various pigments. Bile, produced by the liver, plays a crucial role in the digestion of dietary fats. As bile is solely required during the process of digestion, there is no continuous need for the body to release bile into the duodenum when no food is present from the stomach. To clarify further, the duodenum is the initial section of the small intestine where bile ducts deposit bile, enabling its vital role in fat digestion. Consequently, when our stomach is empty, the passage connecting the bile ducts and the duodenum remains closed, and all the bile is stored within the gallbladder. However, when we consume food, the gallbladder contracts, releasing bile into the bile ducts, allowing it to flow into the duodenum for digestion. I purposely reiterated the term flow because it connects to the development of gallstones. Within bile, water is among the components, and as bile is stored in the gallbladder, an organ with a limited capacity of approximately 50 milliliters, it gradually becomes concentrated and thicker. It is during this stage that the formation of gallstones, medically referred to as cholelithiasis or gallstones, may take place. The underlying mechanism involves an imbalance between the quantity of water and the substances within bile. If the gallbladder experiences excessive water loss or an elevation in the concentration of bile components such as cholesterol, bicarbonate, and certain pigments, the bile becomes highly concentrated and saturated. Ultimately, it can solidify and give rise to the formation of small stones within the gallbladder. Having grasped this concept, let's delve into 4 significant symptoms and signs that indicate a potential presence of gallstones. Nevertheless, it is vital to recognize that most individuals do not exhibit any symptoms. The small stones typically remain within the gallbladder without causing any complications. In certain cases, these stones are so minute that they pass through the bile and are expelled in the stool without our knowledge. When a gallstone becomes symptomatic, it may present with the initial indication known as dyspepsia. But what exactly is dyspepsia? It refers to a discomforting sensation that arises after eating, characterized by mild regurgitation and a feeling of heaviness in the upper abdomen, epigastric region. In the context of gallstones, this sensation tends to worsen when consuming fatty foods, particularly fried items, and specific foods such as chocolate. The second indicator is pain. As a gallstone surpasses the size of the gallbladder's opening, it can become lodged there, obstructing the exit and impeding the flow of remaining bile. When you consume food, signals from the stomach and duodenum alert the gallbladder of incoming food, triggering its contraction to expel bile. However, due to the presence of the stone, the passage remains closed. This leads to a significant buildup of pressure within the gallbladder, resulting in the characteristic pain of a gallbladder colic. The intensity of the gallbladder colic is influenced by the degree of fat content in the meal, as a higher fat content provokes stronger contraction stimuli for the gallbladder. Thus, the pain experienced during a gallbladder colic becomes more intense with increasingly fatty meals. The third indication involves the presence of fever and vomiting. At this point, a more severe condition of the gallbladder, known as cholecystitis, may be at play. Cholecystitis is a complication that arises from gallstones. When the gallbladder becomes blocked, it becomes more vulnerable to infections and inflammation. Naturally occurring intestinal bacteria like Escherichia coli, Klebsiella, and Enterobacter can infect the stagnant bile within the obstructed gallbladder, giving rise to a condition called infectious cholecystitis. As a consequence, fever and vomiting can occur as accompanying symptoms. Lastly, the fourth indicator is jaundice, characterized by the yellowing of the skin. While jaundice is commonly associated with hepatitis or other liver-related issues, it can also be caused by gallstones. This happens when any of the stones traverse the gallbladder outlet but become lodged in the bile ducts, obstructing the normal flow of bile. As a result, bile accumulates and backs up into the liver, eventually getting absorbed into the bloodstream. This leads to the manifestation of jaundice, characterized by a yellowish discoloration of the skin and eyes. It is crucial to be aware that in the presence of abdominal pain, fever, vomiting, and jaundice, the latter two being particularly significant, it is imperative to seek immediate medical evaluation at emergency medical services. Under no circumstances should you delay seeking medical assistance if any of these symptoms manifest. It is essential to promptly seek medical attention for a thorough evaluation and, if required, appropriate treatment. To summarize, gallstones often remain asymptomatic in the majority of individuals. However, when symptoms do arise, warning signs include dyspepsia, intense pain, gallbladder colic, fever and vomiting, and jaundice. Should you experience any of these indications, it is crucial to promptly seek medical advice to obtain an accurate diagnosis and receive an appropriate treatment plan. Thank you for watching today's video on gallstones. I hope you found the information helpful and informative. If you enjoyed the content, don't forget to give this video a thumbs up and consider subscribing to the channel for more health-related content. Remember, your health is important, so if you experience any of the mentioned symptoms or signs, it's crucial to seek medical attention for proper diagnosis and treatment. Stay healthy, take care, and I'll see you in the next video.